Research on twins has suggested that adhering to a vegan diet can lead to improved cardiovascular health. After conducting a study with 22 sets of identical twins, a team of researchers from Stanford Medicine discovered that a plant-based diet can have a positive impact on cardiovascular health in just 8 weeks. The relationship between a reduced meat intake and improved cardiovascular health is a widely accepted fact. However, numerous obstacles hinder dietary studies, including genetic variation, upbringing, and individual lifestyle choices. Identical twins were utilized in this study to address these challenges. Since the twins were raised in the same households and reported similar lifestyles, the researchers were able to control for genetic factors and limit the influence of other variables. According to Christopher Gardner, PhD, the Rehnborg-Farquhar professor and a professor of medicine, this study not only presented a revolutionary approach to affirm that veganism is a healthier diet in comparison to the standard omnivore diet, but it was also a delight to conduct with the twins. The twins had an amusingly similar fashion sense, tone of voice, and humorous back-and-forth exchanges that could only be developed from spending an excessive amount of time together. The senior author of the study, scheduled to be published on November 30th in JAMA Network Open, is Gardner, co-first authored by Landry, a former postdoctoral scholar at Stanford Prevention Research Center, now at UC Irvine, and Ward, a postdoctoral scholar at the center. The study consisted of 22 pairs of identical twins, totaling 44 participants, who were monitored during a trial that lasted from May to July 2022. The study authors specifically picked healthy participants without cardiovascular disease from the Stanford Twin Registry, a database of fraternal and identical twins who have consented to partake in research studies. One twin from each pair was matched with either a vegan or omnivore diet. The two diets were both nutritious, containing an abundance of fruits, vegetables, legumes, and whole grains. Additionally, they were free of sugars and refined starches. However, the vegan diet was exclusively plant-based and did not include any animal-derived products such as eggs or dairy. Conversely, the omnivorous diet incorporated a variety of animal-sourced foods, including chicken, fish, eggs, cheese, and dairy. For the initial month-long period, a meal delivery service provided 21 meals weekly, which comprised 7 breakfasts, 7 lunches, and 7 dinners. For the subsequent 4 weeks, the participants were responsible for preparing their own meals. Throughout the course of the study, a registered dietitian, informally referred to as a diet whisperer by Gardner, was available to provide advice and address any inquiries related to the diets being followed. Participants were required to maintain a food diary and were interviewed about their dietary habits. According to Gardner, the study was completed by a total of 43 participants. The results of the study have shown that it is entirely possible to learn how to prepare a healthy diet in just 4 weeks. According to Gardner, a professor at the Stanford Prevention Research Center, our research utilized a universal diet accessible to everyone, as evidenced by 21 out of 22 vegans successfully adhering to the regimen. These results suggest that anyone who adopts a vegan diet may experience long-term health benefits in as little as 2 months, with the most significant improvements seen during the first month. The study indicated that the most notable changes occurred during the first 4 weeks of the dietary shift. Participants following a vegan diet experienced a substantial decrease in low-density lipoprotein cholesterol, LDL-C, insulin, and body weight, all of which contribute to enhanced cardiovascular health when compared to the omnivore participants. Throughout the course of the study, the participants were weighed and had their blood drawn on 3 separate occasions. At the onset of the trial, 4 weeks into the study, and finally at the 8-week mark. The average baseline LDL-C level of vegan participants was recorded as 110.7 mg/dl, while omnivore participants were found to have an average LDL-C level of 118.5 mg/dl. By the conclusion of the study, the LDL-C level for vegans had plummeted to 95.5 mg/dl, whereas omnivores exhibited a drop to 116.1 mg/dl. It is widely accepted that a healthy LDL-C level should not exceed 100 mg/dl. Gardner has speculated that the participants who have higher LDL-C levels at baseline may show a greater change than those who already have healthy levels, as there is less room for improvement among the latter. The individuals who adhered to a vegan diet displayed a decrease of approximately 20% in fasting insulin levels. Higher levels of insulin are associated with an increased risk of developing diabetes. Additionally, the vegan group exhibited an average weight loss of 4.2 pounds greater than that of the omnivorous participants. Gardner suggested that, considering the results and the concept of longevity, it would be advantageous for the majority of individuals to shift towards a diet that is predominantly plant-based. According to Gardner, those who participated in a vegan diet, and even the omnivores to some degree, made significant strides in bettering their cardiovascular health by adhering to 3 crucial steps. These steps included a reduction in the consumption of saturated fats, a higher intake of dietary fiber, and weight loss. Gardner stresses that while not everyone may choose to adopt a completely vegan lifestyle, even slight movement towards plant-based diets can have a positive impact on overall health. Gardner also notes that beyond cardiovascular health, a vegan diet has additional advantages, such as increasing the number of beneficial gut bacteria and slowing the aging process through the reduction of telomere loss in the body. Gardner, who has been predominantly vegan for 40 years, suggests that the inclusion of plant-based foods in one's diet is more crucial than adopting a strictly vegan lifestyle. Experimenting with a variety of vegan multicultural cuisines, such as Indian masala, Asian stir-fry, and African lentil-based dishes, can be an enjoyable and effective initial step towards a healthier diet. Gardner holds memberships in various prestigious research institutions at Stanford University, including the Woodside Human Performance Alliance, the Maternal and Child Health Research Institute, the Stanford Cancer Institute, and the Stanford Cardiovascular Institute. The funding for the study was provided by several sources, namely the Vogt Foundation, the National Heart, Lung and Blood Institute, and the Stanford Clinical and Translational Science Award. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.